Hello, and thank you for joining us for today's mental health mini-series. My name is Shelby Lee, and I'm joined by my colleague, Kalpreet Lockhart. We are registered health professionals who are members of the AMDSB Mental Health and Wellbeing team. Today, we're going to take some time to discuss depression in children and youth. Our hope is that following this presentation, you will be able to recognize the signs when your child is distressed and have the skills and knowledge to connect your child with the appropriate mental health support. We also hope to offer strategies to support your child's mental health at home.
It is important that we start by defining what depression is to ensure we have common language and mutual understanding. Depression, otherwise known as major depressive disorder or clinical depression, is a common and serious mood disorder. To be diagnosed with depression, medical professionals rely on criteria outlined in the Diagnostic and Statistical Manual, or DSM-5. Symptoms must be present for at least 2 weeks, and the individual must be experiencing 5 or more symptoms during the same 2-week period. The following symptoms would be experienced most of the day or nearly every day. Depressed mood, markedly diminished interest or pleasure in all or almost all activities, significant weight loss when not dieting or weight gain, or decrease or increase in appetite, a slowing down of thought and a reduction of physical movement observable by others, not merely subjective feelings of restlessness or being slowed down, fatigue or loss of energy, feelings of worthlessness or excessive or inappropriate guilt, diminished ability to think or concentrate or indecisiveness, recurrent thoughts of death, recurrent suicidal ideation without a specific plan or a suicide attempt or a specific plan for committing suicide. To receive a diagnosis of depression, these symptoms must cause the individual clinically significant distress or impairment in social, occupational, or other important areas of functioning. The symptoms must also not be a result of substance abuse or another medical condition. As mental health counselors, we have the ability to screen for depression. However, a formal diagnosis would require an assessment from a psychologist or a psychiatrist.
At some level, we've all had experiences with low mood and may struggle with our well-being at times. This is normal and a part of growing, learning, and maturing. For youth, it is developmentally normal to experience moodiness, as well as rule and limit testing. Throughout adolescence, there is a drive for independence and a tendency to begin distancing themselves from their caregivers. At the same time, there's a heavy reliance on creating connections with fellow peers, and it is normal for adolescents to worry about belonging and fitting in with others and being perceived as normal. One of the hallmarks of adolescence is to develop their sense of self. Therefore, it is common that they may struggle with their sense of identity.
At some point, your child's behavior may become worrisome, and it is good to know when you should reach out for mental health support. For children and adolescents, depression may present itself through how they are thinking, what they are feeling, and their subsequent behavior. We have listed some examples on the screen to help you identify what issues your child or adolescent may present with if they are suffering from depression. Feeling sad or empty, thoughts of death or suicide, aches and pains, overeating and weight gain, lack of appetite, poor memory, concentration, and decision making, insomnia or lack of sleep, fatigue and lack of energy, anger and irritability, no pleasure in activities, feeling excessively guilty, feeling worthless, feeling hopeless or helpless.
The experience of depression is common for youth. According to the World Health Organization, depression is the 4th leading cause of illness and disability among adolescents and the 11th leading cause for children. Along with this statistic, depression rates are higher in females, racial minorities, and individuals that belong to the 2S LGBTQ+ community. Depression is a treatable condition, and the majority of people who are depressed can recover. 2 common forms of therapy are cognitive behavioral therapy, CBT, or interpersonal therapy, IPT. CBT is an intervention that teaches individuals how to change unhelpful thoughts and how to learn new behaviors, like taking steps towards goals, spending more time doing positive activities, and learning how to problem solve. The therapist and client identify unhelpful thoughts and behaviors and come up with new ones to practice and try out. IPT is an intervention that focuses on patterns of interactions with other people. The therapist and client identify unhelpful patterns of interactions and come up with new ones to practice. Another treatment for depression is the use of antidepressant medication. These medications work on the brain to uplift and calm down moods. Medication is not the only treatment, but it can be taken along while doing therapy. It is important that you consult with a physician regarding the right diagnosis and the right course of treatment for your child.
School is an important place in promoting positive mental health and helping to build student skills and resiliency. What this looks like can vary based on the needs of the student. The first level, Tier 1, is the foundational everyday work school staff do to welcome and include students, to understand them and build knowledge of mental health, to promote mentally healthy habits, and to partner with parents, students, and other staff to create a supportive environment. Most of the mental health work in schools is at this level. The second level, Tier 2, focuses on prevention and early intervention. In every class in school, there will be some students who may need additional support in the classroom. Educators and school staff can help by reinforcing skills and working to remove barriers to learning. School mental health professionals can provide intervention services like counseling at this level. The third level, Tier 3, services support students requiring more intensive assessment and intervention services. The role of school staff is to help students to access appropriate community or health services and to provide needed ongoing care while students are at school. Overall, schools are uniquely positioned for mental health promotion, early identification, prevention, and early intervention services. All school staff work in partnership with community and health partners as part of a system of care.
As a caregiver, you have the most important role to notice when your child is experiencing distress that can result in changes in their thoughts, their feelings, or the way they behave. We have included some resources that can help to assess your child's well-being. The first is the School Mental Health Ontario Caregiver Tip Sheet. This tip sheet explores how parents and caregivers can identify if their child might be experiencing a mental health problem. Our team finds the With Care abbreviation to be a supportive tool when connecting with caregivers. With looks at assessing changes. So we look at when did the concern start? How intense is the concern? Given your child's age and stage of development, how serious is it at this time? What is the timing and how often is it happening? How frequently are you noticing the concern? Is it a change from before? And how is this concern impacting my child and their daily life? If you do have concerns for your child, please contact your school's administrator.
The CARE abbreviation involves how parents can help their child manage temporary distress in healthy ways through the care you provide. Here are 4 things parents can try at home. Practice calm together, find the awesome in the everyday, including the great outdoors, and model gratitude. Set routines that are easy to follow and include time for fun, connection, and rest. Engage in physical activities. Get outside and let nature soothe your child.
It would be remiss of us to not take this opportunity to raise awareness about suicide prevention and intervention while talking about depression. If you are worried that your child's depression is worsening, please reach out and talk to your child. Raising the topic of suicide with your child will make it easier for them to confide in you if they are having trouble in this area. School Mental Health Ontario has created this Prepare, Prevent, Respond resource, which outlines the steps to help broach this difficult conversation. Start the conversation by asking your child how they're feeling. Listen as your child describes their current emotional state. Ask directly about suicide. Respond calmly and assure them that you are supporting them. In a few minutes, we will review both community resources and crisis lines that will support you and your child.
On our AMDSB website under the Mental Health and Wellbeing, we have a variety of resources linked, including grade-specific resources for social emotional learning strategies for at home, self-care and mental health strategies to use at home, staying in the zone poster that supports children with naming and coping with emotions, and our virtual relaxation hub.
If your child comes to you and is looking for a recommendation for some self-help tools, these apps and additional online resources will help support your child or youth. These apps are especially useful for youth who are always connected to their devices and need quick access to a skill. Stop, Breathe, and Think Kids is a meditation and mindfulness made easy and fun for kids 5 and up to help them discover and develop their superpowers of sleep, being calm, learning to breathe, or to resolve conflicts. Smiling Mind is a meditation web and app-based program for young people from 7 years and up. It's designed to help bring balance to young lives. Move Mood is an app developed for teenage mental health and uses the evidence-based treatment behavioral activation therapy to help improve your mood by increasing your motivation to carry out tasks that can help you move forward, take control, and feel positive. Mindshift CBT uses scientifically proven strategies based on CBT to help you learn to relax and be mindful, develop more effective ways of thinking, and use active steps to take charge of their mood. Other resources to support mood include Bounce Back Ontario, which is a free guided self-building program managed by the Canadian Mental Health Association. It is designed to help adults and youth 15 and up manage low mood, mild to moderate depression and anxiety, and stress or worry. Wellness Together Canada is a free mental health and substance use website to support people across Canada that provides online resources, tools, apps, and connections to trained volunteers and qualified mental health professionals when needed. Together All is for 16 and up, and it's a digital peer-to-peer mental health support community that's available 24/7 for individuals over the age of 16.
Another resource that you can use to assist with learning and teaching coping strategies is the School Mental Health Ontario website. We encourage you to check out the School Mental Health Ontario YouTube channel, where they have created videos to support you and your children with practicing mood management and mindfulness skills. Some of the videos they have created include guided breathing exercises, body scans, guided imagery exercises, and progressive muscle relaxation skills.
We consider mental health as requiring tiers of support. When child's needs have moved into tier 2 or 3, we need to consider community services that can support their needs. For support with depression, we would recommend a referral to any of the following community agencies. If your child or family is connected to a family health care team, there's an opportunity for counseling services. Most family health teams in Huron and Perth County have mental health counselors on staff that can be referred to through your family doctor. The Huron Perth Center is our county's lead child and youth mental health agency. Family Services Perth Huron provides counseling for youth up to 25, as well as supports for children with disabilities. Two common crisis lines include the Kids Help Phone that offers both call and text options, as well as the Huron Perth Crisis Line. Share these with your child so they know how to access help when you're not around.
Thank you for joining us today. We hope that today's presentation has provided you with a comprehensive overview of depression and mood challenges in children and youth, including the signs and symptoms, and how you as a parent can help to support your child who is struggling with depression or mood challenges.